BKD is proud to be a sponsor of this webinar series. I know particularly today I'm very interested in this topic as we internally are kind of starting to think about what our return to the office might look like on a more permanent basis. Just to introduce BKD, we are a top tier CPA and advisory firm. So we are here locally as well as nationally. We have 18 offices throughout the country. Our clients represent a wide range of industries, and our expertise really goes well beyond your traditional accounting and tax services that you may think of. We also provide risk management, technology, wealth management, and forensic and valuation services, just to name a few. Today, I invite you to explore bkd.com/thoughtware, where we've put together a wealth of information across a variety of topics and industries, which include articles as well as webinars. You'll find a great deal of information about COVID as well, as we've been really on the forefront of providing COVID-related guidance through these difficult times. So with that said, I'll turn it back over to Kim and look forward to today's presentation.
Wonderful. Thank you again, Anna, and for BKD's support. Now we're going to get down to what we're all here for. So I'd like to introduce Tina. Tina, let me make you spotlight over here, Tina, so everyone can see who you are. There we go. So Tina is an employment law attorney and the director of the Employers Council Northern Regional Office in Loveland, Colorado. She represents employers in a wide variety of employment law matters. Tina is a frequent speaker and facilitator of trainings on topics including legal issues in managing employees, harassment prevention, civil rights, managing employee medical issues, diversity, and other subjects. So with that, Tina, we're going to turn it over to you and we'll get going.
Thanks so much, Kim, and thanks, Anna. I think it looks like you're in the right spot on the beach, and I think maybe returning to the office from there might be a little bit tougher than from other spots. So thanks for having me, everybody. It's nice to see some familiar faces and names on the call. And if I haven't met you, it's nice to meet you. We've been working pretty hard at Employers Council over the last year. It's hard to believe it's been more than a year since COVID really shut our businesses down in the United States. And of course, it's affected the world as well for longer. And we're thinking about returning. So we'll spend some time today talking about some considerations for employers as you go back or not. So that's a little teaser for the discussion today. And I will just say that I'm going to ask you for a bit of grace since things are changing pretty rapidly. We all know. We're still absorbing some of the information from the American Rescue Plan Act and some of the funding to address COVID impacts on businesses and individuals filters down into our businesses and our communities. And, you know, we're also seeing new developments with COVID. You probably heard this morning that they're suspending temporarily use of the Johnson & Johnson vaccine because of some side effects. And so hopefully that will get addressed and the vaccine rollout will continue at a pace. I heard this morning 3 million a day in the US. So that's going very fast and it's changing things for us. So stay tuned. We at Employers Council, whether you're a member or not, are putting out a substantial number of resources too for our piece of COVID-19 and the response. So you could go to our website, employerscouncil.org, and access the coronavirus resources page. That tells you how old that page is because it was coronavirus at one point before it was COVID-19, to access material and any updates there as well. I'm going to go ahead and share my screen and put some slides up here. And how's that looking, Kim? Is that the slides? We're good? Okay. So returning to the office after COVID-19. So that's what we've titled today and what employers need to know. Let me move you guys over here. So I know that some of you are probably in critical businesses that have continued to have employees working on site and out in the community with all the safety precautions in place. However, many businesses, COVID-19 caused us to really quickly pivot to working from home. And now as the vaccines become available, more people are vaccinated, the case numbers go down, although we've seen them go up in some places. We're considering as employers returning to the office, and my company is doing this as well. So this session is going to talk about what steps to take to plan for that and to also ease your employees' return. So there's lots of survey data out there. This is just one that I picked that I saw recently. The Challenger Gray and Christmas Incorporated did a survey of a number of employers, and 96% of those companies responding had moved at least some, if not all of their workers to remote. But about a third of them, as of the end of March, had brought some or all of their workers back to the office. And the other big chunk is in the planning stages, like my organization and perhaps like your organization, with about 14% of them planning to bring all workers back. But there are some companies that have not brought anyone back and do not plan to do so. So among its personal impacts and professional impacts of COVID-19, it has definitely changed the work world and how we work as individuals and how we operate as private companies and as public organizations and nonprofit organizations. So definitely before returning, you want to assess your workplace hazards. And if you haven't looked at this, take a look at the Occupational Safety and Health Administration's Return to Work pamphlet. So this has really a very detailed step-by-step analysis that they're recommending. Again, these are guidelines, they're not requirements, that all employers go through. Again, if you're familiar, Occupational Safety and Health Administration and the Occupational Safety Health Act applies to just private employers, but these are good resources for both public sector and private employers of what level of hazard your workers are exposed to and the things that you should be having in your workplace. I will get that email, or I will email that link to Kim. I should have put it on this slide after this session. And before you ask the question, I will send all these slides to Kim as well to share, because I know that that's a question you have after this session, but I was messing with them even this morning. So I'm always working on this stuff to the last minute. And of course, we want to continue to follow public health requirements. So those are changing in Colorado as well. Some of you may have read the Colorado Sun article saying that the COVID dial is going away this week. I've seen April 15th, I've seen April 16th as dates for that. The COVID dial, if you haven't seen it, is that state chart with all the pretty colors on it, 6 different colors of the level of concern for the different counties in the state. And then of course, what goes with each of those colors is the business restrictions and the personal restrictions that are out there. And you're probably pretty familiar with them because maybe you're a 5-star business and you're operating at a lower level, or you've just been paying attention to those limitations. So Colorado is moving away from that, and we will be going to local guidance. So we'll have to determine, Larimer County will make its decisions, Weld County will make its decisions on how they want to operate going forward. And it'll become more of that patchwork quilt again of how we're handling COVID-19. There are some counties that are in the green, which is really operating pretty normally on the COVID dial right now. And but there are several counties, including us, Larimer, in the yellow level, which is 2 levels up from that green at a level of concern. So something to keep in mind as we go through. And as we talked about, what is our new normal in our workplace? I don't think that too many businesses are going back to business completely as usual. but employees may not appreciate, what are the changes that have come about as a result of COVID for your business. So making sure they understand what the new normal is as far as expectations of them as they come into the workplace, what they will see from the company as they come into the workplace. And that's really your communication campaign. And I have folks that work with me who are communication experts. And basically what they tell me is if you feel like you've said it too many times, that's probably just about enough as far as your communication goes with your workers. Make sure that they know what you're doing to keep them safe. Make sure that they know what's expected of them coming back, and what they can expect from the company, and how to communicate if they have a concern, right? One of the big areas of liability for employers throughout this pandemic has been safety kinds of complaints for people who have been in work environments that have maybe not always followed the protocols or had outbreaks and those sorts of things. We even had a new Colorado law come about last July, which was the public health emergency whistleblower law, that applies to, I think, all entities in Colorado and even businesses that employ independent contractors in the state. And it does create a cause of action against employers if they are not following safety protocols, in addition to what the public health orders also have in place. And also if their employees report safety concerns and are retaliated against as a result of doing so. So here's some changes that I'm seeing as being potentially here to stay. And one of them is remote work. We'll talk a little bit more about that at the end of this presentation. There's also a lot of innovation, right? Necessity being the mother of invention for us as businesses. There's been a lot of service delivery that is being done arm's length and virtual. I know that at Employers Council, we had dipped our toe into virtual training, but we went fully on board with virtual training, and maybe some of your companies did as well, with virtual meetings and those kinds of things. That's not going to go away, even though we probably will be resuming in-person training in the summer sometime. So how has your business changed as a result? And what changes are you keeping in how you operate as an organization? Of course, safety protocols will remain. We'll see how that changes, but even, excuse me, even vaccinated individuals, the CDC is still recommending at work that they follow many of the same safety protocols that we have in place. And we're going to have this transition period where we will have both vaccinated and unvaccinated individuals in our workplaces. So it's probably best to keep those safety protocols in place for the time being. I think pandemic caught us off guard for our disaster planning and our business continuity planning. We had planned in Colorado for fires and floods and some things like that we experience more frequently, frankly, than pandemics, thank goodness. But previous pandemics of the bird flu and the swine flu did not, of course, affect us in the same way that COVID-19 has. So we now have, hopefully, part of our disaster and business continuity planning anticipation, and again, hopefully not needed for future situations like COVID-19. And then I'm a little worried the handshake might have gone away. Our social interactions are different, right? We've got that elbow bump now that we're doing instead, and making sure we sneeze into our arm instead of out in the world. I think some of those, and again, getting together outside and giving each other lots of space, I think some of those things will continue. We not only have reduce the incidence of COVID-19 from those changes in our social interactions, but we've also reduced the incidence of just the regular flu and maybe some other stuff. So some of those things may stay. I could imagine expecting, a coworker to wear a mask if they had a cold or something and they were coming back into the workplace in the future. We'll see where that goes. And certainly as a business, our response to illness, I think, has stepped up, employee illness. So I'm not sure that we're going to have that issue of presenteeism, right, where the employee is a trooper and comes to work even though they're ill, and works through it. People aren't going to be heralded for that or rewarded for that anymore. They're probably going to be told, hey, if they weren't already told, it's probably best if you're ill to stay home. And maybe if they can, if you feel well enough, you could work from home, but let's not take a chance on this becoming a bigger issue. So one of the questions we're getting is, can employers require employees to return to the office? And the answer is generally yes. We had, if a business wants to do that, you can absolutely do that. You may need to explore reasonable accommodation for an employee who has a disability that makes them at greater risk of COVID-19. We've been working with those people all along during the pandemic. Also, Colorado has a Pregnancy Fairness Act that requires pregnancy accommodation. I have run into a couple of situations where doctors have recommended that pregnant employees not return due to their pregnancy. So we need to be open to exploring potential for reasonable accommodation in that case as well. The public health orders, and again, we're going to see what the local orders look like, but the current state order, at least for a couple more days, has a list of people who are more vulnerable. I think that the title of that list, at severe risk of illness due to COVID-19, those folks, we have not been able to compel, in most cases, in that yellow level where Larimer County is, we haven't been able to compel those folks to return to work. We've been encouraged to accommodate them. So that could be either through a leave of absence, if they need to work on site and we can't have them working on site right now, or through telework if they can work from home. And then we've been encouraged to accommodate under the state public health orders, parents dealing with kiddos that don't have care or school due to COVID. Now, a lot of that has resolved itself, but not everything. We've also been encouraged to accommodate those living with individuals who are at severe risk of COVID, so they're not exposed and bringing that home, and then caregivers. We'll see what the local orders say and whether they continue that requirement to accommodate for the vulnerable folks, and the encouragement to accommodate for the other folks. As I mentioned before, you certainly want to, if you're requiring employees to return, to hear and address their safety concerns. I would even anticipate that and just get out ahead of it to say, these are all the things that are going to be in place as you return. And this is what level we need you to participate to make sure that you're safe and everyone else is safe coming back to our offices. And then you got to anticipate how you're going to handle refusals. So really the list above and the bulleted items are the situations that you need to accommodate. But you're going to run into other situations where employees are just perhaps fearful or anxious about returning. Maybe they're not in a protected category. So how are you going to approach those situations? Are you going to, ease into it? Are you going to, would you contemplate, separating from those individuals? Again, those are the two extremes of that scenario. So you're going to want to talk to your management team, talk to your counsel about how you want to handle those situations. So where to start? Are we going to do them all at once, right? Or are we going to stagger? I have more of my employers that I've spoken to are staggering people coming back into the workplace, and maybe even at different times, so that not everyone is there at the same moment. Again, the current public health orders do still limit how many people you can have on site. So perhaps you're doing some of that already. Certainly, if you're returning people to the office who have been on furlough or some kind of layoff where they're receiving unemployment benefits, you do want to notify the division of these employees' decision to return or not, because both of those will impact benefits. If the employee has been offered reinstatement and has refused that reinstatement, that could also potentially cut off unemployment benefits depending upon the reason for the employee's refusal. Some of you might have benefits or compensation concerns, right? Do we need to start things that were put on pause while the employee was out? Did we miss the window for their appraisal and review and increase? How are we going to address those kinds of things as we come back? And we're still going to have COVID with us for some time. People are still going to be getting it. So of course, your exposure response plan will be important. PPE is personal protective equipment. So some employers are required to have PPE based on the type of work their employees do. And if you are required to have it, you know it. But that's also something that is covered in OSHA's hazard assessment. Facial coverings are not PPE. So we'll just follow what the mask order requirements are and any local public health order requirements are as they pertain to facial coverings. You might want to limit to essential business travel at first. That's another thing that recently changed. The CDC came out this week with different travel recommendations for people who are vaccinated, right? If you're fully vaccinated, you no longer have to have a COVID test within 1 to 3 days of your travel, and quarantine is not recommended upon your return. It's symptom monitoring, really. So that's changing for both domestic and international travel, although they are still recommending that you do only essential travel. So they don't want the floodgates to open wide. So as a business, we might want to support that in limiting to only essential business travel at first. And then making sure your employees know what your customer visitor protocols will be. And then your customers and visitors also know, with some signage perhaps, of what's expected of them as they come into our offices. But we know that employees are going to be going out and meeting with those customers on their terms or in the public places. So what are those recommendations and requirements that we want to put in place for our businesses? So I mentioned this already, following the local public health orders and aligning with best practices. So the OSHA guidance is one thing that I've mentioned. I've talked about the CDC. Theirs is guidance as well. We could see an actual OSHA standard. So that would go beyond guidance to requirements for all businesses. I did just hear last week that was put on hold. So we don't have that at this point, and I'm wondering if we will, as we hopefully turn the corner on COVID-19. But there's something that's holding that up, so it is on pause. But that will be big news if we do get an OSHA standard, and those will be requirements for all private businesses to follow. Public sector employers are not subject to the Occupational Safety and Health Act, although in many instances, public sector employers, these are the government entities and special districts, they do typically follow, even though they're not required, those standards. So mask wearing. So this is that same Challenger Gray and Christmas survey, 100% at the end of March, right? Employers said they would or do require employees coming back to the office to wear masks. And this is, again, end of March, and things have even changed since the end of March. But 42% said require all the time, 57% require in shared spaces. So Here is the Osha guidance. This was updated January 29th of 21. It's generally applicable, again, to all private companies, but public sector companies can certainly look to it as well. There are separate guidances for healthcare and emergency response organizations that you're going to want to look at if you're in those fields. And these are not mandatory. So I did actually give you the link here, but I'll give you a link to the return to work piece as well. So they're saying, you know, stick to the plan, what we've been doing for a while, right? Social distancing, hygiene, face coverings, and whatever else goes into your employer prevention program. The specific items that they say should go into that program are somebody to coordinate, right, your response in the workplace, you know, the identification of the risks and your measurement for when you're having wow, there's a little feedback there. Hopefully everybody's muted again. Accommodation of high-risk workers, separating symptomatic workers, right, the cleaning. There is some screening and testing pieces here. So we'll talk a little bit more about that, as well as vaccination pieces. So testing, can employers test employees for COVID-19? Yes, and I just wanna highlight here, the reason we can do that, because normally we're not doing medical examinations unless we can show it's job related and consistent with business necessity of our current employees. The reason it fits that standard is because COVID-19 has been determined to be a direct threat to all of us. All right, so this is not applicable in other circumstances. That's why I want to emphasize that. So we can require a negative test before returning to work and periodically without running into problems with the Americans with Disabilities Act. Tests, of course, if we're going to do them, have to be accurate and reliable. The antibody tests are not approved for use in this fashion. So this is the other testing that you may be able to use. I think it's PCR test is what I want to say, but I hope I'm not getting that wrong. So you can also ask if employees have been tested elsewhere and not run it. That's not an impermissible medical inquiry in the situation we're in currently. But you do want to be consistent. You don't want to be sort of lackadaisical about it, asking some employees and not others. You want to have either an all approach or a by position approach. Maybe it's your frontline people that you are asking or requiring to be tested, whereas your administrative people continuing to work from home, we're not going to require it in that instance. That's okay to do, to make that differentiation based on a business factor like that. And again, anticipate how refusals will be handled if employees do not wish to be tested. With testing, it isn't the same kind of accommodation. But I mean, there could be, I suppose, a religious objection to being tested. I haven't run into a medical objection to being tested at this point, like a disability or pregnancy that prevents the really long Q-tip from going up somebody's nose. But if you do run into that, you know, put that on pause and let's factor that in and see what we need to do. So there is a CDC testing guidance. So if you're thinking about putting a testing program in for your employees, I would definitely take a look at that and follow through with what they're recommending. First, we want to let employees know that communicate shows up a few times on this presentation today, and avoid pressure tactics, right, to obtain consent to testing. There's already a differential, right? When the employer is asking their employee to do something, that's enough pressure, frankly, without going further. And then scheduling and payment, most employers who have coverages, the insurance is covering the testing. Some insurance companies still charge some fees that they might pass along to consumers. So know what is going to happen with that payment piece. And how you're going to get results and interpret those results. And if you are testing employees, that is medical information that you must maintain confidentially, separate from the employee's personnel file, with limited access to only those who have a business need to know that information. Getting tons of questions about vaccines these days. So back to the survey. To require or encourage. Most employers are encouraging and not requiring the vaccine. And we'll talk about, if you're thinking about requiring it, what might come up there. So again, 57%, they're going to encourage, 33%, they're not going to mandate, kind of the same thing, right? There's 6% are still determining their approach, right? And a good chunk that want to hope that their workers will be vaccinated before they return to the office. So can employers mandate vaccination? Again, generally, yes. But we are legally obligated to explore accommodation here for employees who have a disability that makes vaccination unwise. It's medically contraindicated for them. This could also come up in pregnancy situation, or for someone who has a sincerely held religious belief against vaccinations. So this is an interactive process where we're going to be gaining information and determining, is there a reasonable accommodation that can be made? Now, I did say that COVID is a direct threat to health and safety. So if there's no accommodation that can be made to remove that threat, the Equal Employment Opportunity Commission has said that we might end up excluding that employee from the workplace. Now, they don't go so far as to say we're going to separate employment. Now, there are instances, though, where you might get to that point. And again, you're going to want to talk about that with your management team and with your counsel if you're at that point. Other considerations for mandating vaccines. So first of all, I ask companies, okay, so your best employee tells you that they will not be vaccinated and they do not have one of those accommodation reasons. Are you going to let them go if they refuse? And if you tell me no, then you're probably not mandating vaccination, right? So that's just something to think about. How will you handle refusals to be vaccinated? Thinking about worker scarcity, thinking about, institutional knowledge, other things that would be lost if you did have to separate from that worker. If you are going to require the vaccination, that time spent getting that vaccination is hours worked for your non-exempt employees. So those are your overtime eligible folks. So you're going to need to record their time and pay that time, and it will be included in the calculation of overtime. If people are doing this on their own, I guess I'm jumping ahead a little here, they may be able to use the public health emergency leave under Healthy Families and Workplaces Act to pay them time if they're taking time during their workday. Also, if you are among the employers that has chosen to extend Families First Coronavirus Response Act leave to your employees into 2021. It's optional at this point. It's not required, but the tax credits are still available for employers who choose to do that. Getting vaccinated is one of the things that employees can use FFCRA leave for, as well as dealing with any adverse reaction to a vaccine. Another tricky piece with the mandating the vaccines right now is that the 3 vaccines that we have, well, I guess it's 2 at this point, that are available now are not through the full FDA approval process. They have emergency use authorization only. So we have seen some suits brought by employees who were under mandatory vaccination programs under this emergency use authorization to say that you're requiring me to basically be a bit of a guinea pig here. I'm being forced to be vaccinated by something that hasn't received the full FDA approval process. Now, the cases I have seen brought have failed, and they've generally been public sector emergency service cases, so police, firefighter kinds of cases that I've seen so far, but it's just something to be aware of as a reason that somebody might protest to the mandatory vaccination program. All of the providers are still pursuing FDA approval, and they will eventually get it. And that will change that game or eliminate that argument at least. If you have a union in place, then requiring the vaccine is probably a required bargaining item. So you have your collective bargaining agreement with the union. There's certain things you bargain over and certain things you do not. This is a change in the terms and conditions of employment. So it's likely something you need to talk to the union about before you put this in place. And I mentioned already, we don't have a COVID standard as yet under the Occupational Safety and Health Act. But we do have increased enforcement. So with the change in administration, OSHA is doing more audits of different workplaces. And it's the workplaces that have had more of the outbreaks that they are going to do these inspections on. So it's meat and poultry processing, it's corrections facilities, it's grocery, those kinds of organizations. I think I might have a list. So before mandating vaccination, you do want to analyze, again, is requiring the vaccine job related and consistent with business necessity? So the things that would go into that evaluation are the transmission risk for any position in your company, and if there are alternatives to vaccination that would relieve the potential for that direct threat. And then of course, we've already talked about local public health orders and state local law limitations. So we're actually starting to see states passing laws. Utah is one of them that will not allow employers to mandate the vaccination. So in Utah, a law passed in the last 2 months that does not allow public sector, so again, government special districts in that state, to require vaccination of their employees. So it's interesting. And we've seen in Florida, there was an executive order. Now, arguably, private employers aren't subject to or limited by an executive order from the governor of the state of Florida, but certainly the state and its agencies are. So, so we'll need to watch for that. We haven't seen much of that in Colorado as yet, but we'll see what happens. So remote work. So this is the case for remote work. And there's probably other things you would add to this list. Some of us, I'll just put myself in the category, went in every day because all my stuff was there, and that I could leave it there when I went home. And I never thought, even though I had the opportunity to work from home, I really didn't take advantage of that pre-COVID. When our company changed and everybody went to work from home, at first I was kicking up a little bit of a fuss, and then I'm like, no, this isn't so bad. As soon as I get myself set up, my commute is much shorter from one part of the house to the other part of the house. My car doesn't have as many miles on it. I'm not dealing with traffic. I can get other things done during the day, all these kinds of things. So be aware that you will have employees like me who appreciate the opportunity to work remotely and may be looking for a different arrangement from their employer going forward. At least a hybrid work from home and work from the office kind of model is where a lot of employees' heads are at. I think those concerns about work from home, about productivity being lower, have a lot of times been dispelled. Maybe some of them have been proven true for your organization, but many of them have been dispelled by this year and more of some people working from home. It also really enables you to potentially retain employees and expand your talent pool when you're looking for people. Now, there's some tricks to that too, right? If you're employing somebody in another state, you are, as a business, you do have business contacts with that state. You do have to have your organization set up properly in that state for workers' compensation, unemployment, tax withholding, all those good things. But you may still, again, be able to expand your pool. Some of the concerns, we're gonna not be able to support our cultures. We got a little bit worried about data security and confidentiality, everything going to people's homes, different distractions. Managing workers remotely is a little different, and collaboration can be different. So this is just a study one of my colleagues pulled out for what do employees want, and nearly 3/4 want to work from home 2 or more days. Then leadership is in a little different place. So leadership may be thinking the office is here to stay and not matching quite up. So there's going to be a bit of a clash here. So as I mentioned earlier, our Employers Council resources are on our website, employerscouncil.org, on the Coronavirus Resources tab. These things are all available to you, whether you're a member of the council or not. I also wanted to include some CDC and Osha resources and state and county public health department websites in case you're operating not just in Colorado, but in other states as well. So that's what I've prepared. I know we have maybe 7 or 8 minutes, Kim. How are we doing on questions?
So please do add your questions to the, well, you can actually just, if you want to just wave, I'll unmute you and you can just ask your question since we do have some extra time. Or if you want to put it in the chat, you can do that as well. I'll start. So Tina, what about asking employees if they've been vaccinated? Is that legal?
It is. So I'm sorry, I should have had that in here. Yes. Asking the employees if they've been vaccinated and requiring them, yes, Margie will share the slides, I promise. And requiring them to show proof of the vaccination. So if you've gone in, you've gotten a card, right, signed by the healthcare provider of when your shots, if you had 2, or your shot, if you had 1, was administered, that's okay. That is not an impermissible medical inquiry under the ADA. But inquiring further is. So if an employee says no and you say, why not? That is getting into medical inquiries. So you don't want to do that if you're encouraging vaccination. If you're mandating vaccination, then, that why not question may be important to determine if there is an accommodation issue.
Okay. And around those same lines, so what if later on, like at events, can you ask just people that are coming to events if they've been vaccinated, or is it just employees?
Well, this is going to be interesting because we're in this transition period where we're going to have both unvaccinated and vaccinated individuals at our events and in our workplaces. And it's going to take a while before we get to a place with herd immunity where unvaccinated individuals are in a group of enough vaccinated individuals where that's safe. So I guess I would say I have some discomfort, right, with asking clients and customers these questions. I know it's okay with employees. So if we are concerned about having vaccinated and unvaccinated people at events, I would follow whatever safety protocols are recommended to avoid or reduce the possibility of infection for now.
Okay.
And see what guidance comes to the forefront. I mean, I'm even a little uncomfortable. We've been getting questions about, well, everybody who works in the warehouse, it wants to take their masks off as soon as everyone is vaccinated. So can we just find out who's vaccinated? Well, think of the peer pressure, right? That might bestow on that individual who hasn't yet or isn't sure or cannot be vaccinated. So I'm a little even comfortable sharing employee to employee at this.
Perfect. Anyone else have questions for Tina? Margie's asking, we have a major event scheduled for early October and a majority of the attendees will be 50 or older. Do you have concerns for a large gathering at that time in October, 150 people plus?
Well, I'll just preface this with, I am not a medical expert or a public health expert. I would, again, Margie, I would be keeping an eye on the local public health requirements and following whatever those are. I do think we will see, and we're already seeing, right, the numbers of people who can gather, well, outside particularly, but even inside going up. So I would follow whatever those requirements are in place. Yeah, because I think it's 65 and up, I want to say, has been the Colorado public health order level where people are on the list as being at increased risk of severe illness from COVID-19. So I would just follow whatever the current public health requirements are at the time.
Another question from Christy regarding remote work. Can the employer require employees to be in the office for weekly staff meetings? Can the employer require employees wanting to work remotely to pick specific days for consistency instead of deciding when they wake up each day?
Yes, yes, and yes.
Should there be an official handbook policy and a request for remote work form completed?
I think that's not a bad idea. We have sample telework policies and we even have telework agreements. So if you want to go that far, but yeah, that sets the expectations for if you're working from home in a hybrid kind of situation, this is what we need. And absolutely, I think you can determine schedule, and I think you could have the requirement for staff meetings. Again, with the caveat that if somebody has a disability or pregnancy or religion, it'd be disability or pregnancy that might get in the way of them being able to come in for those staff meetings. We want to still consider accommodation while that's needed for those folks.
Which document or resource would be best to give guidance on how many employees can be on site?
That's the public health order. So right now we have a statewide public health order. It's on the Colorado Department of Public Health and Environment. So call it CDHE. So you can look up, if you just Google Colorado public health orders, you'll find it. And again, we are in a transition week at this point where it's not expected that that will be renewed. And we will be shifting to county by county. So then I would expect each county, generally they've had COVID pages, to put forth their requirements on those COVID pages. So that is the COVID dial at this moment is what tells you based on the level each county is in, and it'll show you a map of the counties and where they are, what restrictions are currently in place.
And so then after that goes away, people should look at whatever county they're in and follow those public health orders at that point.
Right.
Okay.
And Kim and I were talking before this started, like Routt County, I'm up in Steamboat Springs part-time. Routt County has said, we're going to continue to follow the COVID dial. So they're going to be using that as their guide. I was in a meeting yesterday with Eagle County. They have their own local public health order, but it layers on top of what the state order has required. So they're going to continue that for now. And it's sounding like Larimer County may be making some decisions towards the end of this week on where they're at. If you're in Larimer, I'm not sure of the status of Weld if you're over there.
Okay, any other questions for Tina? So Tina, when you said the vulnerable population, is that also on the CDHE's website as what that defining vulnerable for returning to work? Okay.
It is, and I apologize, they were called vulnerable individuals in the first set of public health orders, and I think they shifted to individuals at risk of severe illness,
Okay,
but they are listed in the public health order in the definitions section. So it's towards the end of the public health order before you get to the appendixes for the different types of specific businesses. So that's where that is.
and so then are you allowed to ask if they have a severe illness? So say someone doesn't want to come back to work and they say they are there, can you require documentation or you just take them for their word?
You can require documentation. So again, if somebody's saying, you know, medically, I am unable to return at this point, then employers can, as part of their interactive process, require the employee to provide some information from their healthcare provider, confirming the existence of a medical condition. You don't get diagnosis, prognosis, you don't get the whole history, and how that limits or affects their ability to perform their job. Yes.
Perfect. Anybody else have questions for Tina? I know I've been hogging her, so jump in here if you have questions.
Kim, this is Tracy Mead.
Hi, Tracy.
Tina, I'm wondering, the comment that you just made about requiring documentation from healthcare provider, could that also apply if someone were living in a household with someone who was considered vulnerable? Could I require that be documented?
It's a good question, Tracy. You're definitely entitled for your employees, right, medical condition to getting documentation. Where you go outside to a family member, it's grayer. Frankly, you don't have the ADA saying you can insist upon it. Now, the public health order does say, you know, we're asked to accommodate. So, so I think that an employer could ask for some confirmation, but it's not the same level of analysis, right, that you would get with an employee about how their medical condition interferes with the ability to perform certain essential functions. I think it's more just confirmation that that person they live with is in one of the categories.
Okay, that's helpful. Thank you.
All right, anybody else want to jump in here? All right. Well, again, thank you, Tina, for a wonderful presentation. We will get you the slides after the event and the recording. And then another big shout out to BKD for making these webinar series available to all of our members and general public. So again, thank you all for attending, and I hope you have a wonderful afternoon. It's looking kind of cold out there, so hopefully you stay warm. So we'll see you at the next one. Thank you again, Tina.
Yep, thanks everybody.